Hey guys, in the interest of transparency, before today's show starts, I just want to let you know that since recording this, I have received my activator pulls from Mandy, and I have been using them clinically. I like them. My patients think I'm a little bit crazy when I bring them out, but it seems to be going well overall, and I'm starting to see some good results. So I just want to throw that out there and let you know that I do have the pulls. I am enjoying playing with them around in the clinic, and I have been using them personally to give them a good trial. Okay, here we go. Hello, welcome to the Senior Rehab Project, the podcast for the community of rehab clinicians working to advance care for older adults. I'm your host, Nicole, and this is the State of the Sniff. In today's episode, we're going to discuss activator poles, which are a modified version of Nordic walking created by a Canadian occupational therapist named Mandy Shintani. I would also like to add that this episode is sponsored by the Academy of Geriatric Physical Therapy. The AGPT works hard to provide us Geri PTs with high-quality content to help us advance our practice. This year's Combined Sections meeting is a great example of that. The AGPT is offering 3 pre-conference courses in DC before CSM kicks off. This year, we can learn about the fundamentals of Tai Chi, how to apply a comprehensive approach to successful aging, or how to effectively manage kyphosis. I know, tough choice, and having a little trouble sitting down with that one myself. To learn more about these course offerings and how you can sign up, just go to geriatricspt.org/SRP, and I'm going to put that link in the show notes so you can find it too. I'm your host, Nicole, and I would like to introduce Mandy Shintani. She's the creator of the activator poles, and I'm really excited for you guys to hear about this. We've had a good conversation. She's got me caught up on some things so far, and I really want to share this with you. So, Mandy, you've been sending me things back and forth. It's been really interesting reading these activator poles and checking out the research you've sent me. Tell me a little bit about yourself. First, like, where's your general practice setting? How did you get involved in rehab? Those kinds of things.
Okay, yeah, my background is an occupational therapist. Okay, I have been a therapist, I'm afraid to say this, for 30 years. And it's been really variable, although primarily my interest has been in geriatrics. So my background varies everything from private practice, community rehab, hospitals, long-term care. So it's been a big variety, but it's primarily been with older adults, although in my private practice, I did see a lot of neurological clients as well.
Okay. So this pole concept, it seems very PT for an OT. So tell
Absolutely.
me how you created this and what made you interested in assistive devices for ambulation.
Well, as you know, occupational therapists were quite obsessed with devices, but absolutely the application of this is primarily used by physiotherapists. And it was really my Swedish neighbor who introduced me to the concept of walking poles. I was doing a master's degree in gerontology. I was looking at active aging trends. And so I basically asked her, why is it that the Swedes are so healthy compared to Canadian? Here in Canada, we had a huge campaign that compared a 7-year-old Swede with a 40-year-old Canadian. And my Swedish neighbor, basically, when she explained the concept to me, she indicated that it's being used by people of all ages, whether you're a preschool right up to an older adult. And when I looked at the research, because I'd never heard of this concept before about using walking poles, whether you're inside or outside, or just in the city streets, I was really blown away by the fact that the research points to the benefits that we are trying to achieve as therapists. So better upright posture, bilateral support, increased walking tolerance, normal gait pattern, because when you use poles, it's the same movement as functional walking, which is just opposite arm and leg.
Okay. Now, when you started to play around with the concept, were you using like ski poles or walking poles, or what did you start with, and how did you adapt it from there to the poles that you have today?
Oh, great question. Well, initially we just started off with regular, like the generic name is Nordic walking. So we used Nordic walking poles. We started off with them being strapless because there is a recent study that was done in Germany by Dr. Knobloch, which shows that straps are related to the highest rate of injury in the sport of Nordic walking. So that rate is really low, but for our rehab clients, of course, they have a very much higher rate for falls. So we started off with just using a generic Nordic walking pole without a strap. And what I found is that people immediately loved using them, particularly in compared to a cane, crutches, or the concept of a walker. And you know how challenging it is sometimes as therapists, we're trying to create a device or situation where the client uses one of these devices for stability, but they hate the perception of that negative perception of aging or disability that goes along with it. And what I found is that clients loved the concept because they felt that they were actually doing a fitness activity. They weren't using a device for rehab, and they felt that it really promoted the whole concept of ability and exercise. So a lot of times when I showed it to the client, interesting enough, a lot of them said to me, "Oh, I get it. You actually want me to exercise while I'm walking, rather than just using a cane just for stability." So from there, what I also found is that a lot of our neuro clients didn't have the grip strength to use the locking system to tighten it. So we changed that to a button lock system. I also found that with we took poles from all over, that particularly a lot of the cheaper poles, the weight bearing capacity could be as low as 20 to 40 pounds. And as you know, for a lot of our neuro clients, they are applying a lot of their weight onto the pole, so I didn't want it to slip. So our button lock system actually was developed to hold up to 200 pounds per pole.
Oh, wow.
And we also changed the base of the pole as well. If you look at our activator pole, what you'll notice is that instead of it having a boot-shaped tip that you'd usually find with the Nordic walking tip, it's got a wide circle tip, which we've called a bell-shaped tip. And that's really to hold the pole in a vertical position. Because what the research shows that we did here in Canada is that when someone is using a pole for stability and balance, the pole really should be in a vertical position, and that bell-shaped tip sort of forces the pole into that position. So those are sort of some of the key changes that we did with the pole. We also made, she just mentioned, we did make the ledge longer so that the person has the ledge, the long ledge, they can rest their hand on to actually apply a downward force for weight bearing. That's also how they do core strengthening. And they also push down that to force themselves more into an upright position.
Okay. So are there still, is this have become a thing in Canada? Are you seeing people do it more and more now? Has it kind of caught on there? Or besides the rehab aspects, is this becoming more of a norm?
Oh, absolutely. Like initially, the way that the sport activity came through Canada was really through both fitness and rehabilitation. So, and actually on the fitness side, we actually found that that moved much more quickly than the rehab side. So people were using it for fitness because what you're doing is a technique somewhat similar to cross-country skiing. Okay. And cross-country skiing actually has the highest cardiovascular, it provides the highest cardiovascular activity in terms of fitness. So essentially what you're doing is, when you're doing Nordic walking, is your upper body is doing a technique somewhat similar to cross-country skiing, and your lower body is just doing walking. It really targets your core muscles, which, as you know, are key in terms of rehabilitation.
Yep.
And so it really took off on the fitness side. And then it was really more about 5 or 6 years ago that we then started seeing a complete change of practice here in Canada. So therapists started realizing that this was a more effective change of practice compared to the use of canes, walkers, and crutches when appropriate for clients.
Okay. Another thing I wanted to ask you was, when I adjust a walker or a cane for a patient, even when I have it adjusted perfectly to the height that it's supposed to be at, a lot of times I still have a lot of forward flexion. I still have a lot of weight bearing through the device. What height is the activator pole supposed to be? How do you prevent them from doing that? I know you have two, but I could see people like out in front and kind of slouched over. So
Absolutely. Well, one of the reasons what we found with the walker is that, as much as you say, as a therapist, we get them at the right height, we encourage them to stand upright. We generally see them walking away or in the community and they're in that forward flexion position. I think part of the reason why people are doing that is because they're actually starting to lean more and more on the walker, and that sort of promotes that forward flexion. I'll just mention some of the other challenges we noticed with the walker too, is that when they are leaning on the walker, just like if I got you to stand up right now and lean on the desk, like you're leaning on a walker.
I'm doing it. You can't see me, but I'm doing it.
Well, what do you know in terms of your core muscles when you do that, when you're leaning on your...
Oh, they're not really doing anything. I'm putting a lot of weight through my arms and shoulders.
Exactly. So that was the other thing that we found, is that you're literally doing no core engagement. And what about your arms?
I can feel all the weight in through them, and I could see how that would get tiring quickly.
Exactly. And the other thing is that you've got your arms also in a static position. So the thing about the walker is that you've got the forward flexion you mentioned, you're not doing any engagement of the core, and there is no arm swing. The other thing we found with the walker too is that they've got very limited space. Maybe that's one of the reasons why they push it up front too. Mm-hmm. So their stride reduces. Yeah. We also found that when you lean on something, your balance indicators also aren't being used. Your balance skills tend to weaken. So the whole idea behind the poles is that when you have the pole, the bilateral support, and you're pressing down to do that weight bearing, when that pressing down on the ledge there actually forces you into more of an upright position as well.
So, and that would help keep your base of support, your center of gravity over your base of support, instead of widening yourself onto the walker and kind of being in between the two of you.
Absolutely. Absolutely. And so to answer your question, just to go back, what we changed in the technique as well is that we tell therapists to have their client bend their elbow to about 90 degrees. Okay. So when they do that, they're able to keep that pole in that vertical position. And it also just helps to facilitate them applying that downward force too on the pole for the weight bearing.
And this is the difference too, you were saying earlier about how when you're walking with a pole for fitness, it's more that like the pole kind of goes more on a diagonal, but these poles are meant to be upright, and that's the change of the base, right?
Absolutely. So I just want to reinforce when you talk about, keeping the poles on a diagonal and, keeping a straight arm, that's sort of more to do with the generic technique, which is called Nordic walking. We've kind of coined it as urban poling here in Canada. That technique is excellent for a client who's got very mild symptoms. So someone who basically, can do functional walking, but you really want them to exercise. So mild strokes, mild Parkinson's, mild ABI, they actually will do better with that technique. But the reason why we changed it to this base and to alter the technique would be for that client who's beyond the mild stages of those neurological conditions. And you can actually just say, with the activator pole, you absolutely can progress the client to that technique by just changing the tip at the base. So by pulling off the rubber tip at the bottom, you can actually plunk on a rubber tip and have them move towards the move them towards the Nordic walking technique as they improve.
What is the lowest level patient that you've seen trialed with these activator poles?
Well, absolutely. We've seen a lot of therapists use the poles with clients who are long-term walker users. So that is based on their assessment. Of course, they're initially assessing and trialing the client with the poles under their assistance and supervision. And generally what they're doing in that case is that they're using the poles with the client until they can gain more strength, a better posture, a better coordination until they can feel that they can use the poles independently. At the same time, we have some therapists who feel like the client will be safer using their walker for their day-to-day mobility, but feel that the client still would benefit from using the poles with themselves during sessions, or eventually to doing independent and 30 or hour routine at home with the poles, but still continue to use the walker for their day-to-day function. At the same time, in terms of stroke clients, we've had some clients that, again, maybe going home with in a walker, with a wheelchair, but have used the poles for seated and standing exercises, or again with the therapist, use it for gait retraining or just mobilizing inside their home. So we've had some very low level clients be able to use the poles, again, under the therapist's assessment and assistance and supervision.
Now, I know you wanted to highlight some of the results you've seen with Parkinson's with these poles.
Oh, absolutely. Like, in terms of the different types of clients we've had use the poles, I would say the highest number of client group we've had use the poles are pre and post hip and knee surgery. But the people who call us the most, through the 13 years that we've been using the poles, are people with Parkinson's. And if I can just give you two examples of two extraordinary fellows who have Parkinson's, I think it sort of highlights some of the benefits. So first of all, we've got Harry McMurtry. Harry had early onset Parkinson's disease. He is 58 years old. He actually used the poles to walk from New York City to Toronto last year. And what you can see, if you look at the news clips of Harry, is that initially when he started off doing the walk, you can see he wasn't using the poles, and you can see that he's not doing a lot of arm swing on one side. He's leaning forward. He's obviously in great shape to be able to complete this walk. I believe he did about 15 kilometers per day. But what he found is that at the end of a couple of the days during his first week or two doing the event, he actually fell because he was quite fatigued. Okay. So a therapist introduced him to the activator poles, and she said the change was immediate. He stood more upright. He increased his stride. He started walking with a symmetrical walking pattern, so he increased his arm swing. But for Harry, the biggest change was that he never fell again after using the poles because he had that bilateral support. On the other hand, we've got a fellow, Bill Trewin, who is from the Maritimes. Bill, in his late 60s, had mild to mid-stage Parkinson's, actually completed 22 half marathons. And what he found was when he used the poles, and he did more of the Nordic walking urban poling technique, because he really wanted to help to facilitate increasing that stride and going at a faster speed. And that's what happens when the poles are more on a diagonal. You can actually really improve your gait speed. What he found is that the poles were propelling him forward to the point where it improved his coordination. He got less freezing movement, and he increased his gait speed, and it gave him just that fluency that it helped him so that he could easily complete these half marathons. And he felt that effect as well, even for a couple hours when he wasn't using that pole. So that fluency, that less freezing, that improved coordination. He said there definitely was some carry on, as well as helping him to maintain that high level of physical status to stay active. The other thing I'll just mention too for a Parkinson's client is for that lower level client where we see that they're really doing that shuffling gait pattern. They're not moving their arms, they're stooped forward, very small gait stride. what we found for a lot of those clients is that the poles actually help to exaggerate all the movements of their gait. Okay. So that exaggerates arm swing, that gait stride. And for a lot of clients, when I first started having them use the poles, I was like, okay, why is it now compared to using a cane that you're actually lifting up and bending your knee and doing more of a heel-toe gait pattern? And a lot of them told me it's that they said, well, I just feel more confident because I've got this bilateral support. I'm pressing down on the ledge, and I feel like I have the ability to lift up my leg and do that heel toe in a safe manner.
That's really interesting too. I kind of would love to see this. I have to come back to the fact that you're an OT, and from the OT perspective, I can teach people to walk as a PT, but you have to teach them to manage all their stuff, right? So with these poles, you don't have your nice little walker basket. You don't have your little tray to balance your food on. How do you manage your stuff with these poles? Because you have one in each hand.
Oh, that is a great question. That's a common question that we do get from therapists. And a couple notes on that. If client wants to just use one pair of the pole for going shopping, so they do have a free arm, I don't think it should be like an all or none rule. And same with the walker and cane as well. If there are times where the client feels that they want to use a cane, or they feel like they want to have that benefits of the walker for that seat and the basket, I think absolutely they should incorporate these different tools into their lifestyle and use them when they see them appropriate. The benefit of them still using one pole compared to the cane would be that the pole actually forces them to stand more upright. Their wrist will now be in a neutral position compared to that hyperextended position that you've got with the cane. I find even with the one pole, you can still encourage them to do that opposite arm and leg, and so that that they still get into that gait pattern. But absolutely, so I would just say the main thing is to use devices when they see appropriate. The other thing we've also suggested is use a shoulder bag. They're really popular here in Canada now. So are the fanny packs, or have you seen those as well? We've also encouraged clients to use those.
Fanny packs, like she has a collection. We love it.
Okay. We've had clients use knapsacks. So there are different ways that you can also look at carrying items if the client wants to, use the poles bilaterally to do things like going shopping or go to the mall, go to the mailbox, or just, picking up items, or want to have their purse contents with them.
Now, my final question about the poles. So I'm in America, you're in Canada. This would be an out-of-pocket expense for all of my patients. We can pretty much get a wheelchair or a walker or a cane covered. I mean, it's like one thing every 5 years. So this would definitely be an out-of-pocket expense. How do I explain that? I don't want to say justify, but how do I make that make sense to a patient?
Mm-hmm. Oh, no, great question. I would say that if the therapist has a pair of poles that they can actually trial with the client and they can explain the benefits, that really seems to have made clients recognize that it's worth it as an investment. And actually, we have the same thing here in Canada. People are just buying them privately because very similar to the US, they can get some of those devices covered, or actually in a lot of places you can't even get walkers and canes covered. But for those clients who can, they've just seen that the benefit of using the pole in terms of a change of gait pattern has been beneficial. We've had a lot of therapists actually videotape the client. So videotape them using a cane or a walker, and then videotape them using the poles so they can show it back to the client about what changes, can be expected. The other thing I would say that a lot of therapists do is they get them to do a little demonstration, and that is that they'll get the client to hold the pole in their one hand and actually press down on the ledge and show how it results in contraction. So I'll just get you to do the same thing, Sarah. Just put your hand out and rest it on top of your desk as if you are pushing down on the ledge of this handle. And what are you experiencing every time you sort of press down on the top of the desk?
I can feel like an abdominal contraction.
Absolutely. So what we get people to experience is that, to get understanding that every time you press down this pole, you're actually getting an engagement of the abdominal. So for example, for you, if you were to walk for 10 minutes, you'd actually get 1,000 contractions happening in your abs. It's one of the reasons why the activity is so popular as a fitness activity. It's so effective for that core strengthening. But for that rehab client, we also show them, now feel it on your lats, your pecs, your biceps, your triceps. Every time you're swinging down, you're getting a contraction in all of those muscles. So I think that really helps. The other thing that really helps out is if the therapist does it herself, because so many times clients look up to therapists, and if the therapist has tried it even for herself, I think it comes across so much more authentic about what the benefits are, and the person also feels less, I think, hesitant to try out something that is a new device in the US. So if he hears, oh, the therapist has tried it outside, she really liked it, she recognizes that the benefits outweigh utilizing something that's new in her community. That is also really going to help out with acceptance.
To arrange this call, we kind of had to go around your schedule. You seem to be kind of jetting all over talking about these things, which is exciting. Have you had any sessions in the US? Where have you been? Where are you seeing interest in the world growing for these? What does the wider PT community see?
Well, I think a lot of physios have been using, particularly in Scandinavia, the poles for, the generic Nordic walking. And there has been some application, absolutely, in terms of rehabilitation. But there seems to be a tremendous amount of interest from physiotherapists worldwide as this, for a change of practice in comparison to the use of canes and as an option to reduce the use of walkers or delay them. And we've been traveling lately to the UK, to Ireland, to Australia, and we've just seen a lot of excitement around having further options compared to what we traditionally have used in terms of these passive devices. In terms of the US, we've just started, but absolutely, we've seen a lot of interest from Parkinson's groups, from stroke groups. I've been doing some webinars, and we have been asked as well to come down to the US and start doing some talks, particularly, I would say, around Parkinson's. We had the Parkinson Women's blog just wrote an article, and that's resulted in requests for presentations. We also will be launching, we have a full day activator course, and we're hoping to launch that into the US over the next few months. So people could stay tuned to that. That would be great. I've talked initially about Parkinson's, but stroke I find so interesting because, for stroke clients, our general practice is to use a cane. And what I found with the cane is that when we provide a cane to a client, we're basically providing a tool that increases, the sensory output, the visual cueing, the proprioceptive cueing to that person to their normal side. So to me, it's actually going away what we're trying to achieve, and that is, how do we get our client to be more aware of that affected side? Whereas if you put the poles into the client's affected arm, you are providing that sensory, visual, and proprioceptive cueing to that affected side. So the other thing that I found when you're using a cane is that it really facilitates that compensatory movement. So that hip hiking, now you get that person doing that trunk rotation because they're looking at the cane. They're not putting much weight on that other foot because they can just lean on that cane and put all their weight on that good side when they're walking. And the other thing is they're not swinging their arms. Whereas if you put poles into the hands of someone who has had a stroke, you're forcing them to use that pole during their arm swing, even if that's for an inch or a couple centimeters. It's still helping to facilitate. They actually now turn and face forward because they're no longer rotating their trunk just to look at that cane. It forces them to apply a downward force on that affected leg to do that weight bearing. So for so many reasons, I think that this could actually revolutionize how we do stroke rehabilitation. If there's very little movement and your feeling is as a therapist that that is actually more of a tripping hazard when they're walking, what we suggest here in Canada is just use one pole to begin with for functional walking, but use two poles for seated, standing, and pre-gait exercises. And I'll just tell you one trick we've also been doing too is that we've actually been telling therapists, hey, like even pull the poles apart. Like the pole is adjustable. There's two sections to it. Pull the pole apart. If you're worried about that person, swinging around that entire pole, and just have them use just the top section in that affected hand. Some of the therapists even have to put a glove, or they need to wrap the pole in that hand, that affected hand, if they can't even hold on to it. But it just makes it less easier to use if they're using it for seated and standing and pre-gait exercises.
Okay. That's a really interesting concept. I love the idea of, bringing some focus back to that affected side while walking, because you're right. There is a lot going on the quote unquote normal side, and then your affected side is just kind of along for the ride a lot of times. It's really interesting, Mandy. I feel like you've given us like a lot of good ideas, and it's interesting to see where this is going. And
there is actually 240 independent studies on PubMed just on the activity of Nordic walking, but I'll just send you a small summary of highlights of that. And I just mentioned too, we've actually have 8 ongoing studies on the activator here in Canada and the UK. So let me just send you a summary as well on the research on the activator poles.
Thank you so much for agreeing to talk to me. This was excellent. Is there anything else you feel like we missed or you want to add, or?
Just in terms of, from an OT perspective, how much the poles help people to also do other activities. So just, final point, you can pull off the rubber tip. There is a carbide steel tip there, just like a hiking pole. So if you want to get your client as well to do hiking, walking in the parks, activities with family and friends. We even have, a lot of clients do snowshoeing here in Canada, or just traveling. So a lot of clients have said, I wasn't able, I didn't think I'd be able to take this trip because I didn't think I was going to be able to go on, some of the walks and parks or trails along with family members. So just how it helps to facilitate that into a broader view of staying more active overall.
Thank you again so much for joining me today, and I really appreciate it.
Thanks a lot, Nicole. Take care. Bye-bye.
Thank you for listening to the Senior Rehab Project. If you've gained anything from this episode, please consider supporting our work. You can become a patron through Patreon, a service that allows people like you to support people like us. You can give as little as $1 a month, or become a game changer for $8.99 a month, where you'll get an awesome redefined old mug and access to our monthly meetups. Just go to seniorrehabproject.com to learn more and find the show notes for this episode. Talk to you soon, and do not forget to stay funky.